Neck pain exercises. Okay, so I'm just going to show you some basic exercises you can do to help manage your neck pain. In today's modern world, when everyone is looking at their cell phones, hunching over a laptop, doing a lot of desk work, teachers marking papers, we tend to be hunching like this or over like this. And this tends to lead to the strain of the neck muscles. So one of the exercises that can be done is a tennis ball massage of the trapezius muscles. So the trapezius muscles would be here. So even though it technically is not the neck, the trapezius muscles do tend to get affected when we have poor head posture. Also as well, tight trapezius muscles can lead to or exacerbate existing neck pain. So what can be done, you take a tennis ball and put yourself against a wall. And what you're going to do, you're going to use the tennis ball to massage the muscle between the spine and the shoulder blade. Face away from the wall, take your hand, all right? So you see where the tennis ball is, then you lean against the tennis ball, move up and down gently. You will feel some tight spots. Some spots will be a bit more painful than others. When you reach, for example, a trigger point or a tight spot or what is called a knot, you move some side to side, focus movement, some short up and down, maybe some circular movements to really get that tight spot out. You can also grab your shoulder, the opposite shoulder, put a stretch on that trapezius muscle, up and down, really massaging how the trapezius muscle, come down even lower, really get to the top of that trapezius muscle, side to side, up and down. Okay, and then when you do that for about 1 to 2 minutes, and then you can switch over to the other side. Next exercise for neck pain, it is for the chin tuck. So as the name suggests, you're going to tuck the chin, but I'm going to show you the proper way to do it. When you do this exercise, you're making a double chin. So sit down, look straight ahead, and you look at an imaginary point in front of you, and then you draw the head backward like this. Okay, so you draw, double chin, you'll feel these muscles behind here working, release. Double chin, release. Double chin, release. If you notice, my head is not tilting downward or upward. Okay, so when I draw backward, I'm not getting this movement or that movement. Okay, it's just the head moving straight back like this. Double chin and release. And release. So you may get feel some tension in these zones right here as you pull the head back. A little trick you can use is to actually throw the head forward first. So instead of coming back, you're going forward like this. Yeah. And then you come back. Double chin. All the way. Double chin. Okay, so that is your chin tuck exercise. So for neck pain, we can do a simple neck stretch, a simple side to side neck stretch. So what you will do, you will normally have one side that's more painful or one side that's tighter than the other. So for me, the right side is a bit tighter. So what I'll do, I would start stretching the right side first, stretch the left side, and end with the right side. So now you can stretch each side more than once, but what I want you to do is to think that the side that is more tight, you're starting with that side and you're ending with that side. So in my case, I actually will do one more stretch on the right than on the left. So I'll start with the right, look straight ahead, tilt the head to the side. Think as if you're trying to touch the ear to the shoulder. Okay, try not to let the head tilt forward like this or tilt backward. Okay, just try to to the side. If you want to put a little bit of an extra stretch, you can just take the hand, gentle pressure, you'll feel that stretch increase. And when you're done, put the hand here and just bring the head back to the neutral position. Then go to the other side. Stretch. Put the hand if you want. Put some extra stretch on that side. Slide the hand back to the neutral position. And of course, I will do one extra for the right side. Stretch. Normally, you'll hold each side for about 30 seconds to a minute. And yes. Now, a word of warning, if you're doing this side-to-side stretch and you begin to feel tingling or numbness in the hands or the fingers, you need to stop. You actually may have a herniated disc pinching on a nerve. Okay, so let's just say for argument's sake, I put my head this way to stretch this side, but then I begin to feel some tingling and numbness on the left side. I may actually have a disc that is bulging on the left, and this worsened by me putting the head in this position. If I get tingling or numbness worsening in this position, I need to stop. Okay, and then at this point an x-ray may be needed to get more detail as to what is going on with the neck. This next neck exercise is called the nose to ceiling. So as the name suggests, I'm going to throw my nose towards the ceiling, but in a lying down position. I will tend to target the scalene muscles here. When these muscles are tight, they tend to compress on the nerves that supply the hand and the arms. And when these nerves get compressed, you tend to get tingling and numbness in the hands. However, a next cause of tingling and numbness in the hands can be herniated disc and pinched nerve within the neck itself. So one couple situations can cause tingling and numbness in the hands. One of them being the tight scalene muscles which press on the brachial plexus or the nerves that come off the neck that supply the hand. So for this exercise, you're going to lie on flat. In this exercise, the head is actually going to leave the bed. So I'm looking at the ceiling and I'm thinking about touching the ceiling with my nose. Coming up, notice how the head has left the bed and back down. Up, hold it, and back down. You normally do this for 10 to 15 times. Okay, if you want to make the exercise a little more advanced, what you can do when you come up, turn to the side, turn to the side, neutral, back down. Up, turn to the side, turn to the side, neutral, and back down. But of course, start with this movement first until you're comfortable. Notice the head is leaving the bed and back down. Again, as you get more and more comfortable over the coming weeks, you may want to do a turn, and back down. If you're doing neck exercises and you're feeling dizzy, or you feel like you want to black out, or you're getting tingling and numbness in the hands, you need to stop and get further investigation where your neck pain is concerned. Okay, so I hope you enjoyed this little tutorial session where neck pain exercises are concerned. If you are having neck pain, then you can contact us. We are here in Chincuna Road in Cunupia, 747-529-7-308-3370. You can call or WhatsApp. If you have any MRI reports, X-ray reports, X-ray scans, any films that you want to take pictures of and send to us on WhatsApp, you can do that. We'll take a look at them and give you some feedback.